Good morning. Welcome, agents and brokers. I'm Valeria Hernandez from Benavest. Today, we will help you master your skills with this Health Sherpa OEP 2024 training webinar. After our presentation, we will open the floor for your questions. Let me introduce our guest speaker for today. He is Ross Baker.
Awesome. Thanks for that introduction, Valeria. Great to be here. And thank you, everybody, for joining us today with this OEP kickoff webinar that's hosted by Benavest and their Insure University. All right. So we're going to go ahead and get started, if that works for you, Valeria. And again, my name is Ross Baker. I'm one of the senior agency account managers here. So I work with a lot of the large national FMOs and their downlines to make sure that they're up to date on everything Health Sherpa is building, things CMS is requiring us to build, and making sure agents are getting the most out of the platform and understand how to best use it in your businesses. And what we're going to go through today is exactly that. We'll talk a bit about Health Sherpa, who we are, talk a bit about some industry updates. We'll go over real quick an account setup. I'm thinking most of you probably have accounts, but we'll touch on how to set up your account, how to get ready to sell for OEP, some things you may want to revisit before this OEP as well. We'll talk about Health Sherpa updates. These are product improvements that we have made and are working on launching before OEP here. We'll do a quick platform review live, basically a live demo, just to touch on a couple pieces in your account there. And then at the end, we have a ton of additional resources that can be helpful for getting started. We've got a whole slide deck of compliance and consent related resources, as well as how to access our support team. And I think we should have some time for Q&A and feedback at the end here. And again, this Valeria mentioned this is being recorded. If you have questions, you can put them in the Q&A tool on your Zoom toolbar so we can keep track of who we're getting to, whose questions we're answering, things like that. And then at the end of the webinar, we'll try to cover all those. And this deck will be distributed as well, so all of the links will be available. All right, so who is Health Sherpa? So Health Sherpa is a marketplace technology company. We were founded in 2013. Actually, we were incorporated in 2012, and Health Sherpa was officially launched in 2013 as essentially an alternative to healthcare.gov. And if you think about it, healthcare.gov is really a consumer-focused website made for people to go on and enroll in their own health insurance. Like, that's so easy and everyone can do it. So Health Sherpa is essentially the agent and broker version of that. So we work directly with CMS. We connect to healthcare.gov. We're phase 3 EDE approved, which I'll talk a bit more on later. That essentially means you can do all application types and all scenarios directly on Health Sherpa here. In that time span, we've enrolled over 17 million lives through the Health Sherpa platform. That's been assisted by 4,800 agencies, for over 45,000 unique agents and brokers. And we've done 7 million of those lives during this plan year right now. So if you're just getting into ACA, this is a great time to be in the market, and it's growing faster than ever. All right, so what is Enhanced Direct Enrollment, or EDE? EDE is essentially a CMS-approved enrollment pathway. It allows Health Sherpa to fully integrate with healthcare.gov to submit applications without being redirected to healthcare.gov. There's also data feeds to keep you up to date with all of your ACA clients, right in one central location. You can see their policy statuses, real-time document statuses, all of their marketplace notices, 1095As, things like that, all in one central location. And we're adding quite a bit to this over the next few months here. This is a snapshot of last year's OEP. So through Health Sherpa, 55% of all agent broker healthcare.gov enrollments came through Health Sherpa. And that's about 83% of EDE enrollments. And the average agent did about 100 enrollments last OEP. The best thing about Health Sherpa, in my opinion, here is the 7.5 minute average EDE app time. So that means every app takes an average of 7.5 minutes versus about 20 to 25 on healthcare.gov. And about 40% of the total ACA volume comes through Health Sherpa, and 50% of all new FFM enrollments, because we all know that agents and brokers using Health Sherpa are really the ones reaching those underserved communities that aren't aware of healthcare.gov and need to get on a subsidized health plan. If we look on the right here, we do have some updates with regards to states. So I want to call out 3 states specifically. So you can see Virginia is grayed out here. That is because for 2023, it was a state-based, federally facilitated federal platform is what it's actually called. So basically meaning Virginia, the state, did all of the marketing and operations this year, but they still used healthcare.gov. Starting on 11/1/2023, Virginia is going to be a complete state-based marketplace, just like Pennsylvania, New York, New Jersey, Maryland. And they are going to have no enrollment capabilities on Health Sherpa at this time. So if you're selling in Virginia, you're going to need to get state certified through the Virginia marketplace. And you'll also need to become familiar with their state-based enrollment website. I have on Kentucky, Kentucky is a state-based marketplace fully run by the state. They have their own enrollment website. However, we have integrated with them where you can do what's called the double redirect application. If you've been in the ACA for a while, you may recall double redirect is essentially where you create a client on Health Sherpa, you redirect out to the state-based enrollment website, in this case, KY Connect. You complete the application there, and then you click a button at the end of the application to bring that client data into your Health Sherpa account. So it allows you to still manage Kentucky clients through Health Sherpa. You just have to do their application essentially. And we are working towards full EDE integration in Kentucky. And then I know there was a lot of chatter and some confusion around Georgia this year. Georgia was hoping to go full state-based marketplace with fully integrated EDE for this OEP, but CMS wasn't too keen on that idea, and they pushed them back 1 year. So Georgia is going to be a state-based marketplace federal platform this year, like Virginia was this previous 2023 plan year. So essentially, Georgia will do some marketing and operations. They'll run the consumer support desk, but all enrollments will still be through healthcare.gov, which means Health Sherpa is going to be the exact same as it was for plan year 2023 in Georgia. You'll be able to quote, enroll, manage all of your clients right on Health Sherpa. And actually, when Georgia does go live for 2025, I guess, they will be fully integrated with EDE still. So we were ready to go this OEP, but we're just going to be more ready to go for next OEP. And essentially, it should be almost exactly the same from a Health Sherpa agent experience standpoint. We're really hoping that Georgia's kind of our flagship state-based marketplace that you can enroll through so we can get some of these other dark blue states to jump on board and connect to EDE with Health Sherpa. Okay, that was a long state update. So let's get into the rest of the presentation here. So when you first set up your account here, it's important to understand that you do need to turn on EDE if this is your first time with a Health Sherpa account. And when you click this Enable EDE button, you essentially get some multiple choice questions about your personal credit history that help verify your identity. And this is a CMS required step. And then the second identity verification step required by CMS is integrating your FFM account. I know this has been somewhat of an kind of annoying thing for some agents here. It's required by CMS. They do require that you refresh that every 30 days to maintain access. So it's just something we have to deal with at this point. We're trying to get them to push the refresh to 60 days since you have to change your CMS password every 60 days anyway. And joining an upline agency. So when you create your Health Sherpa agent account or Health Sherpa agency account, you can link that account to your upline agency. So if you're an agency or an agent directly under Benevest, you can use this code. If you have your own agency and want to invite agents, you'll have your own join code. Every agency has their own join code. But this really just gives your upline visibility into your production data. They can help with servicing, DMI resolution, reconciling commissions, performing compliance checks, and just overall helping monitor your book of business there and getting access to additional trainings from yours truly. All right, and the final piece here that's really important, everybody's going to want to do this before OEP, is the carrier settings page. So in your account under this gear icon, there's the carriers tab. This is where you indicate all of the states you're licensed in and the carriers that you're appointed with. And if you're using the Health Sherpa referral program, this is where you can indicate that you want to do a referral application for those states. So it's really important to do this before OEP. You don't want to be in a fully booked day and say, hey, why can't I run a quote in Georgia? Oh, it's because I didn't say I was licensed in Georgia. I've seen it a lot. It's just a silly misstep that wastes a lot of time. So don't be that person and get it done ahead of time. All right, so we've got some Health Sherpa updates here. Many of you using the platform daily have probably seen our new kind of phase 1 rollout of our consent tools. So active consent rules by CMS went into effect on June 18th. We've got links to review those rules here at the end of the presentation, but we're trying to build some tools to help agents and brokers comply with those rules. So step 1 is the ability to attach proof of consent to your Health Sherpa client record or application record. So as you can see here, right on the plan selection page before you process the enrollment, you can upload consent files, whether text, audio, or image, to attach those to the application. You can say, no thanks, I don't need this. I already have proof of consent in my own records, or you can upload those consent files later. And these consent records are stored for the required 10 years by CMS. And then from your clients page, you can now access and upload consent as well. So if you say, I'll upload it later, you can find this client from your client dashboard and upload consent right here. somewhat similar to how you currently upload documents for DMIs and SVIs. You can also quickly access these records so that you can download them and send them to a consumer or a DOI, CMS, Health Sherpa compliance team, whoever. These consent documents are really helpful not only to protect you to verify you do have permission to work with a consumer, but also to show that consumer relationship and that you've been working together if another agent goes and submits somebody's application without consent. So if you have consent and then that other agent doesn't, it's going to look really bad for them and really good for you, and you'll win that client back, no problem. We do have active consent templates that they're linked here in this link that I'll be sending out with the deck, but we're also going to be adding them into the Health Sherpa platform, so they'll be linked right from your client page where you can upload consent, as well as on the application there, so you can grab these forms to gather consent. These forms were modeled after CMS's publish form. And CMS has told us they're not officially approving any assets for this use, but they were modeled after their forms. And then the next phase of Health Sherpa active consent tools is going to be consent collection. So this will be out by the end of this month. It might look slightly different, but the concept will remain the same, where you have an application, you're able to share the consent form with your client via email directly from that application. The client will receive an email with a link, they'll verify their identity, and they'll submit that consent record, which will attach to the application record and be right in your Health Sherpa account when and if you ever need it. So this will be a huge advancement here pre-OEP. And then we also updated, some of you may have noticed, we updated some of the language around Social Security number when you're in the members section of the application, filling out an applicant's Social Security number. So CMS asked all ED providers to update this language around Social Security number. I think they were seeing a lot of applications without Social Security numbers, which actually, if anybody is applying for coverage and has a Social Security number, it is required that they provide that. And even if they aren't applying for coverage, but say they contribute to household income, it's recommended you put the Social Security number on there as well, just to reduce data matching issues. This can help minimize risk of gaps in coverage or loss of subsidy, which typically results in plan cancellation, mitigate risks of non-consensual enrollments by rogue agents that maybe don't have access to this type of personal data. And we also have a bronze to silver nudge. This, again, is another mandatory update from CMS. So when consumers choose a bronze plan, the platform will surface a prompt to reconsider their choice. Now, I do want to clarify, this is only when consumers are going through your direct marketing link and shopping on their own. This won't be when an agent is driving the application or sorry, the quoting and shopping experience here. So it just recommends, hey, maybe a silver plan would be better because you have cost sharing reduction subsidies available as well. Or you could say, no thanks, continue with that plan. All right, so let's jump into some of these updates here. So I'm in my Health Sherpa account here. I've got my NPN. This is my client dashboard. You can see I've got access to what's called full book in my agency. I can look at just my clients, or I can toggle over to see my entire agency book of business. Um, but where I'm going to start to get ready to sell for this OEP is I'm just going to go to the settings page and verify my information. So I want to make sure, number one, my email address is good, not only for Health Sherpa to contact me, but also consumers. So there's a number of emails that are sent out from your Health Sherpa account on your behalf that if a consumer replies to those emails, it's going to come to this email address here. You also want to verify your name looks good, your NPN's accurate, your FFM username is accurate, and that you're integrated with your FFM account here. If you want to be extra secure, which we highly recommend, you can enable two-factor authentication as well. If you have an agency, you can fill out your agency details here. This would be your company name. Doesn't have to be the legal name, just your DBA is fine. And then you have some options here for your downline agents and emails going out to your client book of business. You can see here, I have an agency, so I have my own join code. I can tell agents to add this join code on their settings page to join my agency, or if I have downline sub-agencies, they can use this, or I could just click this invite tool here to invite them to join my agency. And then if I needed to join an upstream agency like Benevest, I would enter their join code here and click update, and that would link me into their agency. Then I've got some final settings with post-enrollment emails here that we can adjust. So once I've gone through, I've verified all of my information, I'm going to pop over to the bonuses tab, and I'm going to check the referrals program, see if I'm participating in it. If I am, this will be on. I could see my historical referrals here, any outstanding payments. If I need to submit my W-9, it will tell me here. We find a lot of agents actually have payments waiting for them. They just need to submit their W-9. We also have our Medicare referrals program, if that's available to you. We have broker bonuses that will show up here based on the states you're licensed in and what is available. These typically start going live just before OEP and during OEP. And these are platform specific bonuses. They're totally unique to Health Sherpa enrollments that we negotiate with the carriers on your behalf. And so they're above and beyond any upline commissions or bonuses or contests, any carrier contests directly from them, or regular commissions. And then we have our referral associates program where you can invite agents to join, and we'll pay you a $10 bonus every time they submit a referral application here. But to make sure the referrals program is working how we want it to, we're going to go, we can either click carrier settings here or just click the carriers page here to make sure we've got everything set up. So if I go, I can add Florida here. You can see everything is blank here. If I leave this blank, it's going to put my NPN number on every single application I submit. Or if I choose in upline's NPN for NPN override, it's going to put that. But let's say I can't get appointed with Florida Blue like everybody else. I'm going to click refer. And Florida Blue is one of those $25 referral carriers just because we can't get appointed with them either. And you know, maybe I don't have Emeritus or Florida healthcare plans, or let's say I haven't started working with Aetna yet. I could put all these to refer. You can go in and check these as well, just to make sure you keep everything up to date. Once that's set, if I go and either myself or a consumer start an application with Florida Blue, it's going to create a referral application and ask me a couple times if I'm sure I want to refer that. application to Health Sherpa. And when you do a referral, you still own the client relationship, all of that. You can sell other products to the client. Really, we're just putting our NPN on there for commissioning purposes and giving you a one-time referral payout as well. So it's really meant to fill any contracting gaps that you have there. All right, and a couple pieces on the marketing page here. I've mentioned this a couple times, I think, but if you're not aware, you have a direct marketing link. And this is really meant to be a direct consumer quoting flow. So I can come in here, I can enter my zip code, see plans and pricing. It's going to ask me to verify my county. If I'd like to see if I'm eligible for subsidies, I can say I'm a 35-year-old male, continue, one person, household income of 35,000, and it will estimate my tax credit. I can add if I have a special enrollment, and then choose to add doctors or providers and prescription drugs, but ultimately it's going to bring me out to this Health Sherpa quoting page. And from here, if the client saves their information here to come back later, or if they start an application, say they add something to the cart and start the application and create that primary contact, you can see here this is a referral app. If I add my primary contact here, it will automatically save that as a lead for you in your Health Sherpa dashboard. And you can update what's seen on that direct marketing link. You can update your company name, phone number, your logo, colors if you want to get really specific, lifestyle photos. Definitely recommend using either a corporate photo or brand image and not a profile photo for this lifestyle photos. And then if you want to track, say you have this on your website or you're running Facebook ads, you want to track the traffic that's going to that direct marketing link, you can add it as a property in Google Analytics. And it does work with Google Analytics for if you're up on your digital marketing. All right. So once we have all that set up, we're really ready to sell for OEP. And we have three ways to begin an application here. We can just start an application right from scratch before shopping. This might be good if somebody, say, has employer-sponsored coverage and you want to figure out what their exact premium might be before looking at quotes and shopping plans, or if they have a complicated tax situation, something like that. So this will go right into the application. It'll prompt you to first search the marketplace to make sure that there is no existing applications for that consumer. And you'll confirm you have consent to work on behalf of that consumer. You'll search the marketplace. If you do have a application, it may say add to clients or view and dash. If not, we can create a new application. You can also search the marketplace. If you're talking with somebody, they say, hey, I've got ACA, but I think my last agent messed it up. Can you help me? You can go in and just search that marketplace like we just did, grab their application, pull it into your client dashboard. You can see here, if I search Porky Pig, I've got them in my dashboard already, and I can actually go into this application and edit this application. So if a client ever has an existing application, really that's the best way to work with them, is off of that existing application by going to reporting changes and updating the application. You don't really, CMS doesn't want duplicate applications on their end because it causes a lot of issues with regards to how data is displayed, both in your Health Sherpa account and to the consumer. and how carriers are communicated with. So lots of issues from duplicate applications. But for the majority of folks here, when you first interact with a client, you're going to start with a quote on, oh, and one more thing on the search marketplace, actually. The search marketplace tool should only be used when you're ready to claim or create an application. If I do a lot of searches for consumers and I don't find anything, or I don't create an application, I'm going to get a letter from CMS that says, what are you doing with our search marketplace tool? It seems like you're fishing for consumer PII. That's just a heads up there. So again, back to quoting, we can quote on exchange, which is, 99% of the business that comes through Health Sherpa is on exchange. We can quote OffX Medical for select carriers in select states. So I think we work with, or I know we work with most of the Ambetter, UHC, and Cigna states, as well as some Blue Cross Blue Shield states as well, and a couple other smaller regional carriers. We also have OffX Dental for United Health One currently, that you can do the full application right on Health Sherpa. But again, 99% of your time is going to be spent on exchange enrollments. We're going to enter the demographics here for the household, add an applicant here, add a dependent, and then add their income. And again, it's important to distinguish. We've got who's applying for coverage is just who wants to be insured on the coverage, and then the tax household size and the tax household income. So this could be 10, but maybe only one person needs health insurance. If you see I put this too low, it's going to say, hey, looks like everybody's probably eligible for Medicaid. You should send them out to state-based Medicaid. If I put it up here, it's going to tell me, looks like just the children are eligible for children's health insurance program in that state, and the adults are likely eligible for savings, cost savings, and tax credits. So I'm going to make it so that everybody is eligible. On my app, we've got a cost sharing reduction, which helps lowers the out-of-pocket deductible, copayment, coinsurance, and max out-of-pocket, as long as they select a silver plan. So down here on the plan results page, you can see we've got health and on exchange dental. On exchange dental can only be added to a health application the first time you submit that health application. The dental functionality is pretty much the same as health, so I'm just going to stick to health today. We've got our filters over on the left-hand side to filter the plans that are showing. I could drop this down, see some lower plans here as well, anything like this. I can add my provider networks, or sorry, my specific providers that I want to see if they are in network. And then I can add my prescriptions here too. All right, so I've got a couple prescriptions. I've got a brand name and a generic, and then a couple providers here. You can see on this first plan card from Aetna, these providers aren't in network. The generic is covered on the formulary, but the brand name drug is not. If I have to have this brand name drug, I can check that box, and it tells me no plans actually cover that. So if I have to have these providers, I can check both these boxes, and it's only going to show, well, not in this case, but if I have to have this provider, I can see, okay, which plans. I've got 30 plans to choose from that have Sedona Integrative Medical Clinic in network. And then I could check that as well. It's going to keep me at these 30 plans here. I can also filter based on carrier, metal tier, network type, and easy pricing, which is a type of plan category created by CMS. You're going to see more and more easy pricing plans over the next few years, starting this OEP. These are essentially plans that provide pre-deductible copays for PCP specialist visits, including mental health, urgent care, generic and most preferred drugs, physical, speech, and occupational therapy. And they have defined cost sharing amounts. So if we look at all of these easy pricing plans here, we can see across care. Well, let me get rid of this filter real quick so we can see some other carriers. But you can see across carriers, the deductible, the max out of pocket, all of the copays, they're all exactly the same. The only thing that's different is the premium. Same thing with this Blue Cross plan. So that's what easy pricing does. It gives a lot of pre-deductible services for a copay and standardizes the cost sharing. The main difference being the deductible and the network still. Okay. And then of course, eligible for HSA is going to show you HSA plan. So I'm going to filter on silver plans because I know I have that cost sharing subsidy available. And then I'm also going to sort my plan so I can sort by all these different data points up here as well. I like to sort by lowest max out of pocket. And we can see, okay, I've got this silver plan, $4,200 deductible, and all these different plans that I can choose from. I can compare some plans here using this tool. You can compare up to 5 plans at once. And then I can look at this nice table here, shows my premium, my cost sharing. If I have added my providers and prescriptions, those are available here. Shows me which providers are in network, and same thing with what drugs are on the formulary. I can link out to plan details, SBC, formulary, and then the actual carrier brochure can often have some good consumer benefits that aren't captured in the summary of benefits and coverage as well. What's great about this page is I can then send this page directly to my client. I can email this quote, I can type a little message here, or I could just copy this link and it's going to link them directly to the page. So I would copy this link, I'd write a custom email in Gmail and Control or Command K to hyperlink some text and shoot this link out. Wherever I click share, and pull that link from, it's going to direct the consumer to that page. So I could do it here on this page, or if say, hey, this is your best option by far. Say the client has a lot of complicated providers and prescriptions, you can link them directly to a plan details page and say, hey, review this. It's got what you need. I think it's the best plan for you. Also on the on the compare page here, you can also print this out and it offers a great leave behind. It's got the household information that the quote is for. It's got a summary of, actually, it's got the complete table there, and then the agent information on that. You could also print this out and send it as a PDF if you wanted as well. Or sorry, not print it out, but save it and send it as a PDF. And then if I get to the point with this client and say, hey, let me look at these plans, talk them over with my family, we'll connect on Friday. Sounds good. I can go ahead, I can save this lead. And it's going to save to my lead dashboard here. Oops. Hopefully. Okay, maybe that's not working in staging today, but if you've used that before, it will save a lead on your lead dashboard here. And you can click resume that lead based on the status. So the different statuses are going to be shopping, meaning they're in the quoting shopping phase. They haven't started an application. Applying means they've started an application but have not completed it. And confirming means they've actually completed the application, gotten an eligibility determination result from the marketplace, but they haven't yet selected a plan and actually enrolled in the plan. So confirming are kind of the lowest hanging fruit that we want to focus on here. So if I go back to my Onyx quote, I'm going to pop this in real quick. And let's say I want to enroll in a Blue Cross Blue Shield plan. I'm going to add that to my cart. There we go. And start the application. If I wanted to add dental, I'd click keep shopping and go back and select the dental plan as well. And then I'm going to make sure that there are no existing duplicates here. I'm kind of running out of cartoon characters to search. So let me see. All right, so we'll go ahead. They don't have an existing ACA plan, and I can go ahead and create a new application for this consumer. I'll review the privacy statement here, agree to these with the consumer, and go ahead and get into the primary contact. I'll enter their social security number, or if they don't have a social security number, I'll say they don't have it, and then enter address. One reason why the application goes so quickly on Health Sherpa is we hide a lot of unnecessary questions until you answer something and those questions and those fields become necessary. I'm going to enter the email here. I'm going to enter a phone number. If I need to get CMS, if I need to get all of my marketplace resources and documents in a different language, I can indicate that here. Let's do French Creole. And then I can choose to get everything, get notices about your application via email or text now, or both. This is going to help stop sending paper notices to consumers, which I know a lot of agents and consumers are not fans of. It can cause a lot of confusion. So once I create that primary contact, it creates that application and it syncs up with healthcare.gov. Now we're going to get into these application sections. So the first one is defining the tax household. So again, this is going to be everybody in the household should be on the application, just so that we calculate that subsidy accurately. And then we can indicate whether or not everybody on the household is applying for coverage. I'll add a spouse and dependent. And so I've got my 3 people in my household. I'm going to continue. We'll say everybody is applying for coverage for simplicity's sake today. Everyone lives at the same address. They will file taxes. They will file them jointly, and they will be claiming a dependent for their dependent child. Nobody else under the age of 19 lives with them. This is a Medicaid specific question. Then you can see we're into the members section. Again, if people have social security numbers, they should enter their social security number here. If I don't have a social security number, I can attest that this person does not have a social security number. Typically, I will then either choose no on this question and enter some sort of eligible immigration status, or on the next page, I will choose that they are a naturalized citizen and enter some information and numbers on that. Asks if they're a tobacco user, with a very clear definition of what that means. If they've used tobacco 4 more times a week in the past 6 months, this can impact premiums by up to 1.4x. So it really depends on the carrier and the market they're operating in, but it's important to get this accurate and truthful. And then if they're currently incarcerated, if they're an American Indian or Alaska Native, it can open up additional cost sharing. Basically, they're eligible for cost sharing on any metal tier, not just silver. And then asks if they're Hispanic, Latino, or Spanish origin. We'll say no, and say he is Korean. This really is just questions to help CMS and advocate groups understand who they are reaching and how they are reaching them through the ACA as a whole, to make sure they're reaching a lot of the populations that could benefit from subsidized health insurance coverage. Again, this question, if they're naturalized or derived citizen, somebody who is will likely know this, but if they weren't born in the US and became a US citizen somehow, they would say yes and enter some documents here. We'll say no for simplicity's sake again, and I'm gonna blast through all these other ones here. Astro doesn't have a social security number because he's a dog. And all right. We're done the member section, and then we're going to get into the income section here. This is where we want to make sure we capture any household income that's contributing to this tax household. So first off, we'll say yes, they get income. We can indicate job, self-employment. There's actually a ton of different types of income available here that we want to report. But if I say job, I can say enter the number here. I can select how often I get this amount. So maybe I get 20 bucks an hour. I can say 20 bucks an hour and 40 hours a week and save that. And it's going to extrapolate that out into an estimated annual income down here for this member. If this is correct, I can just say yes. Let's assume it's correct. And move forward to Judy here. I'll say Judy is self-employed and she does consulting work, and she makes $1,000 a month, and we'll save that. And let's say maybe she only works half the year. So I'm going to say, is Judy's income for 2023 hard to predict? I'm going to say, first I'm going to say it's not correct. Yes, it's hard to predict. And she's only going to make about $6,000 for all of 2023. I'll continue on here and say Astro gets no income, no deductions, and $0 is accurate. And then additional questions here. These are really around Medicaid eligibility, current coverage, employer-sponsored coverage, HRAs offered, as well as some additional questions here. So you'll go through, you'll read these to your client, see if any of them apply. If they're found not eligible for Medicaid or Children's Health Insurance Program in the past 90 days and tried to apply for coverage, they may be eligible for a special enrollment period, or if they had any coverage from Medicaid or CHIP that has ended soon or is going to end soon. It's these are important with Medicaid unwinding happening this year outside of open enrollment. That can help create a special enrollment period for those consumers. It's going to ask about existing coverage. We're going to say, no, they don't have coverage right now. It's going to ask if they have any HRAs available as well. We'll say no. If they have any employer-sponsored coverage, this could impact the tax credits. So it's really important you identify if anybody is offered employer-sponsored coverage, if they are, which employer offers that coverage, who that coverage is offered to. Many times it's offered to everybody in the household. They just have to pay for it. If that coverage meets minimum value standard, which is kind of a difficult question to ask, but then the actual cost of the premium for the employee, as well as the cost of the premium for the entire household. And this, since they've fixed the family glitch, this is actually going to do a double affordability determination, first for the employee only coverage and then for the household coverage, for whoever else is eligible for that coverage. So if you have any of those scenarios, there's a ton of tooltips in there, and you can chat our support team if you're not sure about some of those questions. Those are some of the more complex apps there. And finally, will anyone lose qualifying health coverage before 11/11/2023? Nobody has coverage. We can say, hey, we just changed our primary place of living. Whoops, not that one. Let's say we just got married on 9/04/2023. And we'll see if this gives me an eligibility determination. So this finalized page, I'm going to review all my client details, make sure everything's accurate, submit this. We'll go through the agreements, attestations, and sign and submit this coverage. Really important to review all of this, including the income amounts provided and personal details with your clients to make sure everything on the application is accurate. And once you finalize that, submit it, it's going to sync up with the marketplace and give you an almost instant eligibility determination based on what we just put on this application. And so once we get that back, we can see that everybody is eligible enroll due to a special enrollment period for marriage. They're eligible for tax credits and eligible for CSRs. And they have a few additional follow-ups, verify income and citizenship by this date. I know that these are caused because I did not have a social security number on the app. So, say there's a scenario where maybe I have George and Judy's social, but I don't have Astro's because they're a child, and most people don't know their child's social security numbers off the top of their head. You can submit the application, and instead of uploading documents to resolve this DMI, you can actually just go back and update the application with this dependent social security number, and it will get rid of that DMI. Shows me my eligibility letter here. I do always recommend, I'm going to download this real quick and actually open it up. If you ever have questions about why an eligibility result is how it is, if you thought, hey, why didn't this person get a SEP, or why is the tax credit slightly different? I would highly recommend opening this marketplace eligibility notice and reviewing it for that particular client, because it's got a ton of information on here that's going to answer any questions you have regarding eligibility. And again, this eligibility notice comes directly from the marketplace and is based off the information that you put on the Health Sherpa application. From here, I can edit the application if I need to, or I can move on to plan selection and review the plan. So this is the final step in enrollment, confirming my plan. I've got this Blue Cross Blue Shield plan, $639 a month. If I wanted to only apply, say I'm not sure about my income, maybe I only want to apply $1,200 a month, so I don't have to pay too much back, I could do that, or just apply it all. If I'm working in an agency where I have an upline that allows me to use their NPN, I could select their NPN as well, or just select my NPN. And then this is this new consent piece. I can now download this consent form here. And then soon there'll be another option here to send this consent form directly out to my client, or I can choose one of these options here. If I'm uploading, I can upload, add that, say I have a screenshot of a email or text conversation, I can upload that and submit the enrollment. And I know we're getting up on time here, so I'm going to switch back to this real quick. All of these resources will be available when I send out the deck to Hugo and Valeria here. They'll help share that out. The CMS guidance and FAQs around compliance rules and regulations, what type of verification or consent do I need to obtain from clients when assisting them with marketplace enrollments. These are all very helpful, very useful items that are going to be a large focus of CMS this year. And then we've got our Health Sherpa agent support team. And if you ever have feedback, questions, ideas on how we can make Health Sherpa better, don't hesitate to reach out and ask. So, whoops, wrong window here. So I've completed the enrollment here, and I've got some clear next steps for this consumer. I want to let them know, hey, you need to make this premium payment by this date. If I want to take premium payment right now and help them do that, I could click this link. And then you've got these required documents, or maybe, if I know they were missing a social security number, I'm going to say, hey, get me your social security number by whatever, as soon as possible, probably, and I'll update the application so we can get rid of these data matching issues. And then I can go back to my dashboard and see that full client information here. All right, so I know we've got a couple questions here in the chat. Aisha, I do not have a list of the FFM states on healthcare.gov for 2023 or 2024, but I can try to send you a copy of that map that was in my presentation. I just need to get it updated for 2024 with Virginia moving to state. RX available error. I don't know what that means, but if you have a more specific question, let me know. How do I enter documents the client has, like derived citizen docs? So that would be back on the application. Those would be added there in the application flow. There's a place to actually upload them. What kind of deductions are they asking about? Good question. So if I'm in the application, I'm going to go back to income here. Deductions are very specific deductions, and I hover over this. It's not like business deductions. It's these very specific deductions that actually take out of AGI to get the modified adjusted gross income. So it's expenses like these. Let's see. What is the agent support number? Let's see. Agent support number is 888-684-1373. Again, I'll send this deck out. You'll have this. Our hours are 9 Eastern to 7 Eastern, Monday through Friday during SEP. And then we'll have extended hours during OEP as well. On the quote under the med name, it said error. I'm not sure what that means, but it's likely just a bug based on being in a staging environment. Sometimes all the carrier names and other names don't load properly. If you have any issues on the actual live quoting platform when you're running a real quote, please let agent support know. I definitely recommend chatting them through the chat function in your account there. All right, Vanessa has, how do I change my agency? Vanessa, if you're with a previous upline, the best way to change your agency is to email agent support. If you know who the agency admin on your previous upline is, you can copy them on that email if in request to be unlinked from that previous upline. Right now, that's the best process we have. Unfortunately, I know it's kind of a manual pain in the butt, but it should be no issue with regards to getting that unlinked. Just email agent support. David Mitchell asks, can you write a standalone dental plan? You can for this OFFX dental. This is only for certain carriers. So like if I do, whoops, what's my zip code? If I do this, we have Blue Cross Blue Shield Arizona, as well as United Health One as a standalone dental option. And United Health One is actually in most states. You do want to make sure you're appointed with UH1 for dental. And that is UH1 is, or Golden Rule Insurance is different than United Healthcare on the exchange. So it's a slightly different appointment. You can talk to your upline, talk to somebody at Benevest about making sure you're appointed with that. But if you want to write UH1 dental, you can actually do the complete app and payment right on Health Sherpa and complete that enrollment. Just make sure you're appointed before you do that. What if the client self-enrolls through a marketing link? How would they sign a consent? Great question. So I left that out of my presentation, but the privacy statement that when you first start an application here, search the marketplace. I'm just gonna create a new app. This privacy statement we have updated to include consent somewhere in here. I'm not exactly sure, but this is updated and compliant so that if somebody enrolls through your consumer marketing link, it will be in line with the consent requirements. Great question, Anonymous. David asks, if a client qualifies for 90% CSR, can I tell them they will only pay $10 of all bills before deductible is met? That is going to depend on the plan and the cost sharing, David. Those are going to vary based on the market, the carrier, the plan type, the network type potentially. So there's tons of variables. I would not use that language unless you've verified it based on the summary of benefits and coverage and the plan details page. A client signed consent for me to work for him or her. Is it okay to have a different in the app, like when you can choose a different NPN? So Magu brings up a great point. She asks, I think she's asking, if I have consent with a client, can I put an NPN override, like my upline agency owner's NPN, on that application? That's actually a great question. Unfortunately, it's kind of unclear from CMS. They were supposed to come out with a FAQ on these new consent rules back in June, and we're still waiting for it. But I would say the best practice would be to gather consent at the agency level, or at least somehow notify that client, preferably in writing or on a recorded line, that what you're doing. Hey, I'm going to put a different NPN, or maybe explain to them what the NPN is first, but I'm going to put a different agent number on your application just for commissioning purposes, something along those lines, just to inform them of what's going on there. Might be a best practice, but totally up to you. Hector Hernandez, good morning, Hector. How accurate and reliable is the provider and medical center's verification when quoting? We find clients sometimes calling that a provider or center is no longer taking the plan. Thank you, Hector. I find this as well. So the way the Health Sherpa provider lookup works is we have the exact same provider data feed that healthcare.gov has. That being said, at times, there could be a hospital that you think is in network that might not be in network, or sorry, that is showing something doesn't look right. You can always use the provider network tool provided by the carrier that's linked from your agent account. So you can enter my state, coverage year 2023. I could even drill down to a specific county and then continue, and it's going to help me look up specify. Now, so this is if something doesn't look right on Health Sherpa or healthcare.gov, because generally Health Sherpa and healthcare.gov are exactly the same. Your next option is to check the carrier's provider network. Now, the crux of the issue here, Hector, is that carriers and providers can literally change their contracting at any time. They could go in January 3rd and say, oh, this entire healthcare system is no longer in our network. It just depends on when those contracts renew, things like that. So unfortunately, I've even ran into cases where I'm showing a provider in network on the carrier's site, and they're not in network anymore. I actually ran into this personally, kind of the other way around, so it wasn't as bad, but I could not verify a doctor in network through my Blue Cross Blue Shield portal. But when I called them, they assured me that this doctor is in network, both Blue Cross Blue Shield and my doctor's office. So really what I would say is it's just works horrible in the industry in general, both in individual insurance, group health insurance, and it's something you want to educate consumers about, to say, hey, if you're going to go to a new provider this year, you definitely want to make sure they're in network. You want to verify with the doctor's office that they're still in network, and contracted with that insurance and try to verify with the your insurance company. One thing that I did see when I was at AHIP this year, at the AHIP conference, was there's a lot of technology tools out there to try to get better, more accurate provider network data for carriers. So hopefully they're adopting some of that. But overall, it's really a pain point throughout all of health insurance in this country. So Anonymous asks, if two agents are running the business in partnership, should client consent mention both agent names, or one can get consent under his, her name, and any of the two can have their info on the app? That's really up to you. CMS has clarified that you can gather consent at the agency level. So if you are working in a partnership and have an agency, I'd recommend doing it that way. But you know, it's not going to hurt to have more information than is necessary on these consent and review documentation. How do you say your last name, Aisha? My last name is Baker. Like the bakery where you get your croissants. And Hugo asks, are the formularies that Health Sherpa has updated throughout the year? Oh, are the formularies updated throughout the year, Hugo? That is a good question. Again, the formularies are fed. Are you talking about the actual formularies here? Because this just links out to the carrier website. If you're talking about the prescription lookup tool here, it's the same as the provider lookup tool. We have the exact same feed that carriers provide the marketplace. I have seen scenarios where that data feed on both healthcare.gov and Health Sherpa is outdated. And it's just because the carrier has changed something and not updated that that feed. So again, if you see anything that is wrong with the provider lookup tool, the prescription lookup tool, any other piece of this, please just chat into support and say, hey, you know, this looks like it's wrong. Or if you ever see like I know CMS just changed, very slightly changed how they calculate the tax credit. So if you see something on Health Sherpa that might be off by a couple cents on healthcare.gov, always chat those things into support or send us an email so that we can actually get them resolved. Great question, Clyde. If we upload our consent information, can it stop AOR changes by any chance? I will answer that by saying getting these consent tools in the platform, getting agents to use them, and gathering a significant amount of data around consent, how it's documented, and things along those lines is going to lead to any additional features that we build upon it. So at this time, it's not necessarily planned that it can stop AOR changes, but if it develops that way, it could definitely be a useful tool for that. We also have some other solutions that we're working on, kind of on the back end to put some soft blocking on suspect applications that we see based on the data. So great question, Clyde. I guess the too long did not read is not at this time, but it could be possible in the future meaning like next year or even years after that. All right. I think that's it. Oh, I did want to show you one last thing on George Jetson here. So if I click into a client details page, that's always going to sync with the marketplace, pull in the most recent application data. One thing that's new here is this consent record is here. I can upload additional consent. I can download these consent files, still have all my marketplace notices. And then we are going to be updating the agent of record so that we show not only the assister name that CMS holds, but also the policy AOR from the most recent sync. And that's going to be important because the policy AOR in some instances can be different than the defined assister value that you see on healthcare.gov. And the policy AOR is who actually gets paid by the carrier. Stephen, yes, you can, we are aware of the social security number is required. No more social security number bypass. We covered that earlier. And Clyde, I believe Valeria or Val is recording this. And you can get the recording from her. And I will also send the deck over to her and Hugo here. Valeria, do you want to jump in with Clyde's question about where can we find agent resources that Benevest has for agents?
Yes, I will give the information in a minute.
Perfect. And then, all right, this will be the last question here. For Maisha, if there's a current AOR on record for a client, does completing a consent override make a new agent who uploaded consent new AOR moving forward? So the consent actually has absolutely nothing to do with AOR at this time. Submitting a new enrollment with a different NPN is going to put a new NPN on that application when it goes to CMS. And based on certain rules, CMS is going to determine whether or not they're going to transmit a new 834 enrollment file to the carrier with that new NPN. And if they do, based on each carrier's individual rules about AOR and commissioning, the carrier is going to decide who to pay. Fronts, we just covered that question, potentially in the future. And yeah, I think that's it. I will get this deck over and let me know how we can help in the future here.
Okay, thank you, Baker, for this presentation. Remember that you can view this webinar again in the All Access Agent portal, logging in through insureuniversity.com. If you want to get contracted or you want to contact us in the future, our support information is here. Please write it down or take a screenshot. Again, thank you so much for joining today's webinar. We're looking forward to see you again on future webinars.